Hello, everyone, and a very warm welcome from the International Society for Neglected Tropical Diseases. Thank you so much to all for joining us today for this ISNTD Connect session. We're going to be looking at taking a closer look today at how can we mainstream NTD interventions into primary healthcare. And we're really fortunate. It's my absolute pleasure to welcome to this panel to delve a little bit deeper into this, these issues. Our four speakers here today who will be giving us a lot of insights from the donor perspective. What does this mean for NTDs? Where do we stand in terms of progress? How can we accelerate this as we stand right now on the cusp of 2025 on the way to those all-important 2030 goals? So please join me in welcoming very, very warmly our panelists. I'm going to go around my screen as they appear in the small rectangles. First on my right, it's my pleasure to welcome you, Arielle Dolegui. Thank you for joining us today. Arielle, you are strategy lead in NTDs, global policy and advocacy at the Bill and Melinda Gates Foundation. Welcome. On your right, I'm also delighted to welcome Ida Marie Ameda. Hi, Ida. Welcome. You're a global lead on NTDs and malaria at UNICEF. It's a pleasure to have you here. Welcome as well, a very warm welcome to Chris Ostendorf. Hi, Chris.
Good morning, good afternoon, good evening, wherever you are.
Thank you so much, Chris. You are Head of Social Impact Development at the Fred Hollows Foundation. And our last speaker on the screen, welcome, a very warm welcome to you, Irene Chami. You are Director of Programs at the End Fund. So really exciting session, 54 countries having eliminated one at least NTD on the way to this really ambitious target that the community has set itself of eliminating 100 NTDs, 100 countries eliminating an NTD by 2030. Amazing progress. We're also coming up to the anniversary of an incredible commitment, a pledge by donors to funding this effort, over $777 million. Promised almost this time last year in Dubai at COP28. So lots of things really lining up very nicely, and not just with the right momentum, but also the right results shining through. So over the next 90 minutes, I'm really delighted to take this moment and take a closer look at where is the progress, but also where are the bottlenecks to really accelerating, reaching those milestones. And the donor landscape in NTDs is certainly a very interesting one. Really amazing spectrum from funders to implementers to funding implementers and everything in between. So I really look forward to a very exciting discussion and conversation. Clearly, I don't need to say that the audience, we want you to be really involved, because that is already happening as we just give this warm welcome. Lots of people have been joining in. I see everyone's introducing themselves. Welcome, Solomon Geresu from Ethiopia, Sarah Mohammed from Sudan. Lovely to have you on board. Carol Kutushi from Nairobi, and many, many more. Please continue to add your comments, your thoughts, and also questions, of course, for our panelists as we progress through our discussions. So without any further delay, it's my pleasure to hand over to you, Ida. UNICEF has been the co-host of this special session, and against the backdrop of what we've just been describing, and also some amazing work at UNICEF to really bring these issues together, working towards a position paper. I'll hand over to you to set the scene for us. Welcome to everyone, and thank you for being here.
So this is a deck just providing an overview of what we have in the position paper in terms of recommendations for mainstreaming prevention and treatment of NTDs into community-based primary healthcare. This is an outline of a slide deck. We'll look at the situation overview and why we think this is important. consider challenges and opportunities, and a set of recommendations. So you are probably all aware about the London Declaration on NTDs. That was 2012. And it provided a really historic moment of collaboration across academia, pharma, funding, and brought really a meaningful reduction of disease burden among the 21 diseases, now 21 diseases prioritized for action globally. And so despite this progress, we know that despite the progress in reduction of people requiring NTD interventions, we do know that NTDs continue to wreak quite a heavy burden on over 1 billion people, many, about 39% in Africa, but many more in parts of Asia and South America. And the DALIs due to NTDs still remain quite high, as do the annual deaths and the impact on communities. This is just a snapshot of the people requiring interventions in 2022 from the roadmap tracker. And a reminder about why we really do need to keep NTDs on the radar. They're a serious marker of inequity, and because they cause significant and debilitating illness and disability among people who are already poor, who are already further behind, they trap them in a life where they cannot be productive as they would wish, really forcing them to live a quality of life that they would rather not. They have an immense impact on children, causing chronic malnutrition, impairment of growth, poor cognitive development, poor school performance, and stigma, and then reinforcing social isolation and discrimination. We know that NTDs have a gendered impact on women and children, girls, on the girl child specifically, some of it due to biological and physiological features, some due to the gender roles that they assume. And yet, we also know that because of gender, some people are inhibited in their capacity to manage these diseases. We're seeing an increasing impact of NTDs in certain places, for example, places affected by drought. There have been reports of increasing cases of Kala-Azar. We're seeing, because of population movement, people entering areas where they are exposed to NTDs that ordinarily they would not be. Because of conflict as well, and because of climate change, some of these trends are changing. There are other factors, of course. We know that some NTDs continue to be neglected, even though we've had quite an improvement because of a commitment of pharma. We still see slow progress on the R&D side. And because of a slow progress, generally speaking, there's a threat to SDG attainment, broadly speaking. So what are the challenges we've seen? We know that there's poor alignment between some of the global funding and priorities at national and subnational level. And because funding has declined, this really is a concern. Another key issue is, despite the global consensus that it's important for it to have integration across the health system and across NTD programs, we note that in many places, the programs remain largely vertical, and some of this is impacting on capacity to raise funding, to leverage funding from other programs. And because we have fairly vertical programs, that also contributes to stretching the health systems further. We know that post-COVID, quite a few health systems have not quite recovered. So it's important to consider ways to integrate further. Quite a few countries have updated their NTD master plans, but we do know that not all have developed sustainability plans. And this, of course, is a missed opportunity to identify and map potential partners. And moving towards 2030 and beyond, this will be really important. NTDs still suffer from, some challenged interministerial coordination and collaboration. And that also limits, in a way, mobilization of resources, including with the ministries of finance, but over and beyond, looking at Ministry of Water, Ministry of Education, and others. What are the other challenges? We spoke to the disruptive impact of climate change. We're seeing more and more protracted conflicts and public health emergencies, which impact on continuity of NTD programs, further threatening progress towards 2030 goals. At the community level, there are unique challenges that the lack of integration creates, including redundancies, but importantly, wastage of resources, among others. We know that we still have across programs some community health workers supporting community level work in a vertical way, focusing on specific disease interventions. In a few countries, you can see some form of integrated preventive and curative interventions, but this is largely not the case. We need more countries to be able to do that. There is lack of systematic community feedback on what we're doing on NTD programs. We see research here and there about knowledge, attitudes, and practices, but it's not systematically collected. Therefore, we have a missed opportunity there to inform programs more systematically. Then a lot of the NTD community data is linked to surveys and campaigns, but this is delinked from routinely collected data. And then finally, on this piece, we know that the supply chain, because it largely focuses on donations, sits mostly outside integrated supply chain systems. And therefore, it challenges further efficient and effective management of the medicines, but also of the treatment data that's linked to the medicines that are donated. And so what are the opportunities? We see them in a couple of broad buckets: around policy, around training and development, around remuneration, and the service package. In 2023, we conducted a community health worker landscape analysis in 42 countries in Africa. Some of the key findings showed us almost 1 million community health workers, and most of them were providing test and treat for malaria, but over and above that, were providing various other services. In terms of policy, we noted that at least 37 of the 42 countries had a community health worker policy document. In 20 countries, community health workers were recognized as part of the national health workforce, and in 15 countries, they were salaried. So in terms of policy, we know that there is a policy in most countries that anchors the community health worker as part of a system. Then in terms of training and deployment, in about 21 countries, we noted that there's pre-service training before deployment, and of those who received pre-service training, almost all were deployed. And then in other countries, about 22, community health workers received in-service training. These are deployed community health workers. So there's an opportunity to train and retrain community health workers already in existence. Then in terms of pay, around 35 countries indicated that at least half were receiving some kind of financial payment, whether it was a salary, a stipend, transport refund, or honorarium. Then the last bit, the service package. Of the countries that responded, 31, about 73%, had NTD prevention and control within the existing service package. And the service package covered at least 15 areas across primary healthcare. And I think quite notable was the fact that community health workers largely remained functional even during humanitarian crisis. It was only 3 countries that reported that they were not providing any service. So in terms of opportunities, we believe that they can't support some of these areas where we have noted gaps. So what are our recommendations? To strengthen community-based primary healthcare delivery. And to do this, we would need to ensure that the curriculum, the training, and the information systems systematically incorporate NTDs in the package of services. Considering that community-owned resources in the NTD space are mapped alongside other community health workforce mapping interventions. strengthening supply chain and equipping community health workers, while also strengthening capacities at the health facility level to address stockouts and bottlenecks related to supplies. Then expanding the capacity of community health workers, at least specific ones, to provide morbidity management and ensuring linkages for referral and other social services. That's the community-based primary health care. We think that there are opportunities to strengthen multi-sectoral coordination and collaboration. We have community health workforce across sectors, and we can do this along priority NTDs to align better, to avoid wastage, and to achieve collective priorities. We have community health information systems in most countries now, and they offer an opportunity to understand what's happening at the community level and to use that information to provide guidance, to provide evidence-informed guidance at the government level and across diseases in high-burden countries. Within the context of humanitarian crisis, we can leverage this community workforce, these resources to continue to ensure that NTD services are not disrupted and to preserve programmatic gains. And then, not to make too fine a point, integration across the health sector while engaging with non-health sector providers will help us to provide more holistic support and address some of the key risks that we see among vulnerable communities, including undernutrition, poor access to wash, and so on. And finally, we have the opportunity of multiple MDAs. Can we consider how to integrate this better across priority countries and to ensure that these communities, when they're reached with services, also benefit from services beyond NTDs? If we do deworming, can we also do vitamin A supplementation and immunization? Those are opportunities that we can tap into a bit more systematically. Some countries are doing them, but others could do a little bit more. Finally, in conclusion, we think that systematic inclusion of NTDs and community-based primary health care will work two ways. Will enhance community health workers' capacity to provide education and optimal care, but at the same time can help to improve distribution, remuneration, training, social support, and their protection as well. We can use these opportunities to build on each other, so to speak. I believe that's it. Thank you.
Thank you, Ida. What a fantastic presentation, really bringing together in a very clear and cohesive way lots of the things that those working in NTDs, that the many varied and numerous stakeholders have been saying, and that's been really organized into this framework. So thank you so much, and really making that case for community-based NTD interventions, ticking all the boxes on that have been guiding the progress in NTDs, whether that be making multi-sectoral cross-disease collaborations much more natural and easy, and all the way to really boosting that country ownership that's been very important in the recent years in that movement. So thank you so much, and lots of solutions as well that you're alluding to, and touch points where the next emphasis can really make a difference. But before we look at what can be done, what promises to really deliver, if we take a step back, and it's a huge privilege for us to have these different types of funders, different stakeholders on this panel with us today. And so I thought perhaps I could first ask you, thinking about the bottlenecks, thinking about what is slowing down progress at the moment, what is your organization's experience, or what, based on perhaps your case studies, your programs, just personal experience, what are you seeing as the main bottlenecks to reaching those all important targets of 2030? Perhaps, Chris, we could start with you at the Fred Hollows Foundation.
Sure. Can you hear me okay?
Yeah.
Okay, great. So the Fred Hollows Foundation is an eye health organization. And so trachoma is our main NTD that we work on. We have trachoma programs in about 12 countries of the 25 countries that we work in globally. Very proud to reiterate that Vietnam and Pakistan have both been recently acknowledged by the WHO as having eliminated trachoma as a public health program. And I know that kudos to and thanks to RTI and USAID. I know that we have a couple people on the call, so I just want to acknowledge that. But to get to your point, your question, we find the bottlenecks are mainly at the community level, where you often have still vertical programs. And even though you can offer integrated MDAs and surveys, it's often not prioritized. And so what we're trying to do at the Fresh Hollows Foundation is to work with our partners and our government agencies to prioritize integrated programming where we can. And as Ida pointed out in the presentation, there's a lot of challenges with that, but we find the bottleneck is really at that community level. And we think when you have too many integrated MDAs, you can get community fatigue. So I think one of the things we have to work on as a sector is to say, how can we overcome some of that community fatigue? Because in places like the Pacific, it sometimes takes a day to get from one island to the other. And if you're going to take the time to get all the way out there, we might as well deliver as many health services as possible, right? So that's as many MDAs, as many non-NTD programming. And I just think that to date has not been prioritized from a community perspective, but also a Ministry of Health perspective.
Fantastic. That's a really good point to bear in mind. Thank you, Chris. Irene, you're representing the N Fund in our discussions today. As your role as a funder, through your perspective, what are the bottlenecks you've seen affect progress the most?
Thank you, Marianne. Can you hear me well?
Yeah, absolutely.
Thank you. The N Fund is a private philanthropic initiative that focuses really on controlling and elimination of 6 most common neglected tropical diseases. And this is trachoma, river blindness, intestinal worms, bilharzia, lymphatic filariasis, which is also elephantiasis, and visceral leishmaniasis. So our efforts are really working with our implementing partners and collaborating with the Ministry of Health in ensuring that we are geared towards reaching the end aligned to the WHO 2030 roadmap. Now, going back to the question, I see an opportunity or challenges in the leadership and governance pillar. I see challenges in the limited, or, our organization sees challenges in the limited or lack of visibility of NTDs, in the knowledge and understanding at all levels, its burden and impact on individuals. So making it a bit challenging for leaders to leverage on opportunities for integration of services and multi-sectoral collaboration. Adding on to that is the issue of ownership and accountability, where, yes, there are relevant policies that, have been developed. However, the operationalization of these policies and guidelines that support primary healthcare integration and coordination efforts lack that particular ownership due to various factors. It could be involvement during that process, including the lack of inclusion of integration of services and multi-sectoral collaboration goals into service level agreements and performance targets across all levels so as to enhance accountability. I'll give the example of Rwanda, where they have been able to really be deliberate in supporting multi-sectoral collaboration, where it is spearheaded by the top leadership, represented by the different sectors, and there's routine intersectoral coordination meetings chaired by the sector leads, and there's joint collaboration, implementation, and monitoring of those activities up to the community level. I also see, challenges in partner coordination, supporting those primary care initiatives, further complicating integration and multi-sectoral coordination efforts, and increasing the risk of duplication and limiting opportunities for complementary efforts. Another area that focus, I think, is the health system financing, where countries, and I think it's evident that NTDs is heavily funded by external partners with minimal or no commitment of country resources. And I think efforts need to be made to just push for domestic resource mobilization guided by the relevant policies. And there is an opportunity there for, sort of better integration and alignment with a community-based primary health care platform, especially when there's available financing in the sector. Yes, thank you very much.
Thank you so much, Irene, and for really putting the focus on leveraging the leaders. While you were speaking, we had a really interesting comment from Gilbert Bayenda. Hello, Gilbert. Thank you for the presentations. One area to consider is advocating for inclusion of NTDs in government's midterm expenditure frameworks and elevating NTD units to department levels where they have a dedicated government vote to ensure sustainability of the gains over the medium term. That's a really good point. Thank you for adding that. And if anyone else, we have lots of expertise in the audience. If anyone else would like to include some comments or thoughts or anything, insights from your work, please do go ahead. I'll hand over now to Arielle to answer the same question. Many of us, will know you from your role as chair at the NNN, also your work at World Vision. So it's really interesting to see kind of your 360 expertise and knowledge. But today you're talking to us as the Gates Foundation. And so what are your insights as that big funder into the bottlenecks to increasing NTD programs?
Yeah, well, thank you, Marianne. So for the Gates Foundation's perspective on NTDs, what our funding has primarily supported sort of the upstream interventions and, for the NTD strategy, which is our sort of comparative advantage. So we're supporting the deployment of tools, we're supporting innovation, we're supporting primarily drug and product development. So by and large, our strategy hasn't so much focused on delivery intervention and programmatic intervention. And when we did so, it was in a way that was very opportunistic. But over the last year or so, I think we've had to do a little bit of a reshift. And some of it was due to funding cuts globally to NTD program. And we had to rethink about, how do we sort of use our position, our funding to leverage and inject additional funding into the NTD program delivery space. So we've had to reshift. And as part of that reshift, it also has helped me rethink how we can sort of support this integration at the country level, integration within the frameworks. But in reality, when we think about challenges, in many ways, the work that we have done globally as a community for NTD was sort of spearheaded by this London Declaration, right? Like which is a massive undertaking, and it's a true representation of what global health is about, bringing together pharmaceutical, public-private partnership, government, and implementing partners to support the implementation and the rollout of NTD program. And in many ways, we're sort of victim of that success, right? Because we have been able since the London Declaration to sort of free 600 million people from NTDs. But all of this success really has been done in a way that is very siloed and very vertical. it is very much done outside of the global health community. It's not unusual for anyone on this call to speak to a minister of health or a leadership within the Ministry of Health, and they will have no idea of the successes that we've been able to achieve at the country level. So we're very much needed this London Declaration. We very much need this vertical funding to address NTD program. And as a result of that, we have sort of siloed our programmatic delivery interventions and our programmatic delivery needs. And that's sort of what, from the Gates Foundation perspective, we're trying to work towards redressing where we can and towards some of our investment. Now, let me be very, very honest and say we do need vertical programs. That's my position, at least. I'm not sure if that's the position of the foundation, but we do need vertical programs, but specifically for NTDs. We do need to be able to continue to uphold the tenets of the London Declaration that has now evolved into the Kigali Declaration of NTDs. We do need to protect the investments made by the pharmaceutical programs. We do need to be able to demonstrate to donors that our programs are cost efficient and that we can get countries to elimination, right? Like in our lifetime, people on this call, we witness countries going through elimination based on the work that the NTD programs are doing. And at the same time, we need to think about how we engage countries and then we move away from siloed program. And the community-based primary healthcare is just that solution to sort of that reshaping and shifting paradigms from vertical to integrated approach without disrupting the vertical programs. So that's the perspective of the foundation, and that's the perspective that I'm hoping that with this call and with this donor group we can evolve towards. Thank you.
Thank you. That's a really great reminder, actually, that this is a fine balance between integrating across a lot of diseases, a lot of intervention, thinking about what Chris mentioned, which is community fatigue as well. And it's really an interesting juggling act. And just very coincidentally, right before coming on this call, I received a very lovely LinkedIn message from someone who was just commenting on how we may not realize it actually, but the NTD sector has managed to really speak almost with a unified voice, although there are disagreements everywhere. And I think that's been an amazing achievement all in the years since the London Declaration. Is so really good to remind us from that. And I'm sure everyone can get behind that distinction between integrating and vertical. And thank you so much. If there aren't any questions at the moment from the audience, and please do go ahead and post any you may have, either for now or our discussion coming up in a few minutes. Now that you've introduced your organizations, not that they needed an introduction to this audience, and also sharing your perspectives, I'd love to kind of flip those bottlenecks round completely and drill down a bit more into, so what next, and what are the interventions? Where are the touch points where you feel integrating in bringing NTD treatment prevention into community health can really make the biggest difference? And that's really now thinking about, is it maternal health? Is it around education, or where should we proceed? And Ida, over to you, because you've really brought us together today with your amazing presentation and all the work behind it at UNICEF to think very carefully about all this. So what might be your perspective on that?
Thank you, Marianne. So a couple of things. One is, I think that we are at an interesting point, an interesting juncture on the global health space. I mean, even community health work for a long time was operating as a program that was quite separate, right? And so there's been an important shift that's happened in the past year, in the past couple of years, coming to a head last year, really. Last year, there was the Liberia Community Health Symposium, and that culminated in the Monrovia Call to Action. And one of the things they did there was recognize community health workers and their contributions across the health system. And there was a call for political support and investments in country-led strategies, looking at professionalizing them, looking at integrating them within the workforce, and making, kind of harmonized accountability framework for them. And so this, I think, is one of the opportunities that is new. We see this year with the establishment of a community health delivery partnership, again, an opportunity to bring multiple stakeholders across countries, donors, and partners, including Africa CDC, which is the African Union charged with overseeing health, together. And so that is an opportunity we see. So the partners are across areas in health. It's not just the NTD community. So we have already there an opportunity to organically, if you will, bring people together to look at common points where we can work a bit more closely together. For me, that's one huge opportunity which we can take advantage of now. Currently, a couple of partners through the CHDP are working on harmonizing curricula, looking at health information systems, looking at training. So we have that opportunity to pitch NTDs as an area where we can develop some sort of minimum without losing out on the elements that we need to pay particular attention to, as Arielle eloquently put it. That would be my first point. Yeah. But over to the next person. We can do a little relay. Thank you.
Marianne, you're muted.
I think you're on mute, Marianne.
I am, because my cat is scratching madly at the door. He's gone now. Arielle, over to you to bounce back on Ida's comments.
Yeah, no, that was that's actually one of the point that I wanted to make in terms of leveraging the community health delivery partnership. For me, when I think about the opportunities that exist, the reality is, and I think with Ada's presentation, this is already happening. We have countries that are already integrating NTDs within their community health packages. It's just not happening in a systematic way. And then also, it's just not happening in alignment with what the national strategies for NTDs is, right? So it's very much happening on the side. So what we're talking about here is sort of enhancing what works and sort of integrating NTDs for once with what the global health community is also moving forward ahead with. So that would require a couple of things. One, it would require us as a community strengthening our advocacy for NTDs and really elevating the profile of NTDs beyond just the NTD program. We work a lot with NTD program managers and NTD program coordinators. How about we start working with the Director of Public Health? How about we start working directly with the planning teams, including the financing, to ensure that they have visibility over the progress that we're making and the challenges that we're making. And that is a collective effort. It's both the effort of the funders to being able to create these sort of flexibility in the funding streams to allow partners to navigate that, but it's also the role of the partners and the implementing team to sort of creating that pathway for visibility of their successes and their challenges in the country level. And then we need to think about this, when we specifically the CHDP, what is really the package of services that we're really thinking about? I love that Chris talked about the community health fatigue, and some of it has to do with community healthcare workers being undertrained and underpaid and overworked. So if we're really talking about integration, how can we help the community quantify the needs of the NTD package of services in such a way that could translate into real investment, so that the next time we're having this panel of conversation, it's not about if we must, but it's about how, and it's about who funds it, and it's about who do we talk to and where do we go to do that. So that's the second thing. And then the third thing is, how do we leverage the continental efforts that are already happening? I mean, I would say even continental and regional efforts that are already happening to professionalize the community healthcare worker needs. And that is really, again, an effort of both And I put the Gates Foundation within that because we're doing a lot of work within the continental and Pan-African organizations. And how do we bring NTDs along with that? And the opportunity to bring NTDs along with those changes is the role of the entire community, and in really ensuring that we're not neglecting the successes that we're making, and we're no longer neglecting the progress that we want to make. I think we're very much guilty of that in this community and taking our success for granted. So that would be my appeal. My appeal is to the community, but my appeal is also for us to really having strong data that we can quantify and measure and translate into funding opportunities.
Yeah. Amazing point. And, it's still a shame that we're still having to talk even to public health professionals about this gigantic bar of global burden of disease, which are NTDs compared to HIV, cancer, etc. And, even the basics sometimes still need to be told. And this is one of the, they are neglected diseases, but it's also a neglected success story. So that's a shame. And a great point here by Carol Karutu, who I believe is tuning in from Kenya, the End Fund. We have a great opportunity with the current push for UHC among the African Union, African member states, with PHC as the pathway to achieve the UHC goals. Great point. Eugene as well. I haven't had the time to read your comment yet, but I will come back to that in a second. So perhaps building on that, Irene, did you have some insights that you could share with us, please?
You can hear me? Yeah. Can you hear me? I've had an issue.
We can. Yeah.
Okay, so I think that we need to also look at further considerations on the need to streamline service delivery mechanisms at the health facility level, so as to provide, improve that access at that point. I see an opportunity in terms of integration of needed NTD services at various service delivery points like maternal child health neonatal clinics to support like female genital schistosomiasis screening and treatment. Leveraging on improve that access to services. I'll give an example of Rwanda, where the program also developed like national NTD algorithms to improve NTD management at the health facility level, though those additional steps are still needed to incorporate new diagnostics. But there's been very good progress in that. Another thing I think in terms of a focus area is a multi-sectoral coordination efforts, and specifically looking at how do we harmonize data like, WASH data, which sometimes is very fragmented, being hosted at different platforms, so that we can be able to really use that to support some of the multi-sectoral linkages with other sectors. So I didn't want to repeat everything that the other panelists had said, which was also part of the opportunities I was also saying.
Wonderful. Chris, over to you.
Yeah. Thanks. I think firstly, when we talk integration, I think the term can mean different things to different people, right? And I think it can mean different things depending on what your goals are. So integrating multiple NTDs is one way. Integrating into other health sectors like WASH is another important thing. But also it's integrating into non-health sectors like education, right? So I think when we talk about integration, you have to think about it on multiple levels. And for the Fred Hollows Foundation and the work that we do and our trachoma elimination goals, it's about integrating into the primary healthcare vision centers. And we believe that the community health sector and the primary health sector is really the first line of defense for surveys and monitoring and identifying where there might be resurgence or recrudescence of certain entities even after elimination. So I think that what we try to do is take a patient-centered approach, which really kind of speaks to that community and primary healthcare level. And I agree with Ida's presentation that there's a lot of opportunities out there, but there's still a lot of challenges. So I'm really excited to be working with UNICEF and others on this call to further develop the community health worker sector. Thank you.
Fantastic. Thank you so much, all four of you. And Eugene Ruberanziza adds, and it's the first time I've seen a comment with 3 yeses straight after. So this is definitely a point being endorsed and agreed to. I think that despite significant health system challenges, countries consistently rely on WHO standards. Embedding NTDs into primary healthcare is becoming an essential priority to sustain NTD programs. To facilitate this transition, new guidelines and frameworks should be developed, along with technical assistance to help countries adapt national policies and strategies for effective integration. A really good point, Eugene. Thank you so much. I think you're tuning in from Kigali. And so that kind of brings us to sort of the third aspect of our discussion, and just kind of thinking about unpacking how do we get from prevention, control, integration into the communities. So let's talk about that support. Let's talk about funding, really. As I said earlier in the call, we do have this amazing commitment. It was quite historic by the many standards of across a number of diseases, not just in NTDs, of course. Lots of varied and different numerous donors coming together around this same goal and agreed framework and strategies. But what's missing and where do we go next? Do we need more funding? I don't mean the usual definitely answer, but like how and why and in which form. And Arielle, since you are representing a major funder, but also because you have to go in a few minutes, and please feel free to go when you need to. And a huge thank you for making time for us today. But for those 2 reasons, I'll hand over to you first.
No, thank you so much, and really thank you for having me for this discussion. The question of funding is always an interesting one, because like you said, it's like do you need more funding? The answer is always yes, and sometimes it's not. Sometimes it's about being good with the funding that we do have. Now, when we started talking earlier, and when Ida presented, so she sort of touched on a couple of bottlenecks, and I think our panelists also touched on a couple of bottlenecks. Issues around supply chain, data systems. We now heard primary healthcare and service delivery, and then some integration with WASH. So when I'm hearing that, I'm hearing different parts of funding, right? Different ability to fund. So I did make the plea earlier for us not equating this call to action for integration with a call to action to de-verticalize our programs. We still need to have funding streams that are dedicated to getting countries to the finish line. But when we think about funding as a community, we also have to be a bit more creative. We have to be creative with how do we leverage the existing funding streams that are already moving to the countries to support these integration with supply chain, with data systems, and with primary healthcare. So that's one thing. And then the second thing is, we talked about the 7 million that was sort of raised in December of last year. One of the opportunities there was an action forcing moment to being able to have a platform where there was a health day, and the NTDs was able to have the ability through advocacy of various people on this call to get NTDs raised the highest level of the profiles, and then have an NTD moment. And this action forcing moment allow for multidisciplinary donors to come to the table and commit funding publicly. We do need to recognize donors love the spotlight, right? Donors love the ability to say, we want to do good, but we want to do good with others. Unfortunately for the NTD community, we do not have enough of those spotlight moments. And when we do, it's happening behind closed doors. So my sort of endeavor over the next 5 years, so it's creating as many action forcing moments as possible for NTD community. But the challenge in getting there, and this is why this call is particularly important, is we need to get to a target. What is the target? How much money do we need to raise, and what is it going to be for? If someone on this call can get us to quantify the needs and to quantify what this package is, I would put my personal capital in helping us supporting and raising that funding. But we're very much challenged with that. So I will end with this by saying truly that we need to work collectively towards action forcing moment. And then we need to think about how we leverage, not asking countries to put in more money, because they're already working in a fiscally constrained environment, but really leveraging the money that is already in the country to support supply chain, domestic data systems, primary healthcare service delivery, and embed the NTD package within that. Thank you.
Arielle, thank you so much, and for reminding us that, yes, finding an answer to how much do you need is really a priority at this point, something that Dr. Sose, head of NTDs at WHO, is very keen on achieving. And actually one of the, well, several of the organizations, but one on this call, which is the N Fund, is really actively trying to get to that figure. So thank you so much, Arielle. And so I'll hand over to you, Irene, as N Fund, a really fascinating organization. You are a funder, but you're also tirelessly working with anything from high net worth individuals to, sending colleagues up Mount Kilimanjaro, just by whatever means necessary, fundraising for NTDs. So you bring a really fascinating perspective to this question.
Yeah, thank you, Marianne. I'll revert back to what I mentioned earlier in the bottlenecks. I think we need to really invest in sustainability initiatives, supporting government ownership and accountability, which is really critical to, sustaining the efforts that we are putting in place and the investments that we're putting in place to reach the end goal. Including this will really play a critical role in, integration of services as well as a multi-sectoral collaboration. I also see an opportunity where we are putting communities at the forefront of NTD prevention, control, and sustainability efforts, investing in their knowledge and understanding, investing in behavior change approaches, and measuring these approaches and initiatives to ensuring that no one is left behind. Because at the end of the day, then the community is really the one to ensure that there are sustained efforts beyond the intensified interventions that we apply. I think we cannot say, the data for decision making is something that is also very, very critical. How are we using the data that we are collecting, evidence-based decision making? How are we using that data to make decisions, and supporting in those initiatives to just strengthen the health system, and as well as healthcare workforce personnel to use the data that they really are collecting for decision making, including continual mapping to assess the burden and gaps, and tailoring approaches to meet the people who are most at need. I see also an opportunity in piloting and scaling of innovations, which is that support integration within the primary healthcare goals, cost-effective, efficient, that help fast-track the achievement of NTD prevention and elimination goals. So I see those as areas where, we need to also, apply priority now and in the future.
Thank you so much, Irene. And a few questions have been coming through on the chat, really related to what we've been speaking about in the last few minutes. So we'll turn to those in a few moments. But before we do that, Chris, it'd be really interesting to hear from you. So as an organization with programs working on trachoma into communities, you, of course, require funding. At the same time, the Fred Hollows Foundation was part of that pledging movement last year at COP28. So there's kind of two sides to the organization, and it'd be really interesting to hear from you. Where does funding need to go from now? What shape should it take, and maybe perhaps some magnitudes?
Firstly, I really appreciate Arielle's comment around the fact that there is funding going into these countries already. So how can we make sure that we're utilizing that and leveraging that for the maximum impact is the first thing that I'd like to say. The second thing is that, yeah, you're right. We do, as the Fred Hollows Foundation, we do act as a funder because we do have quite a strong fundraising team, particularly in Australia. And that funding goes to all of our programming, but particularly with our trachoma work. So what we're trying to do is look for partnerships with other organizations and making sure that where possible, the donor community is speaking to each other and deciding that, where to fund and make sure that there's no duplication of efforts. And I would just like to make a plea for people on this call, including the panelists, that we're always looking for co-contributions and looking for other funding partners. And to that end, I would like that when the donors are speaking to each other, and I know that happens regularly, that they, when possible, involve NGOs, INGOs like the Fred Hollows Foundation, who are not only implementers, but also funders. So I'll end on that. Thanks.
Fantastic. Thank you so much. Oh, wonderful. Arielle's still here. It gives me a last chance to say a huge thank you. Thank you for your very kind comments in the chat. It's been a pleasure having you, and this conversation will definitely to be continued. So thank you for your time. All the best. Bye. So we have a few more minutes left for questions and comments from the audience. So I'm just going to hop over to those in no particular order at the moment, because there's such great questions coming from different angles. But we have one here, just for example, quite specifically around female genital schistosomiasis. So Comfort Olanrewaju is asking, how can one get funding to carry out an awareness campaign on FGS among the PHC workers in one's locality? And even if FGS isn't specifically perhaps your disease of expertise, just do you have recommendations on how to access funding or how to make that case for awareness campaigns in general in one's locality? That's also slightly linked to a question from Raj Mahar. Could we get more on focusing the education sector to prevent NTDs? I'm interpreting your question, Raj. I hope I'm not mistaking that for how can we invest more in the education sector to prevent NTDs. So how do we bridge those gaps between funders and those in the communities who have ideas and who have opportunities to roll out an NTD awareness or an actual prevention program? Ida, perhaps I could hand over back to you. You have a lot of experience at UNICEF of bridging that gap.
Thank you. An interesting question. I'll take the one on education. I think that one of the sectors that we are not collaborating with adequately is education. There's a long history of NTD work in the education space, trachoma elimination, for instance, the work around STH. There's a lot of success that has come from engaging with the education sector. There's still a lot more that we can do, including engaging with education donors. you know. But we have an interesting opportunity through the health promoting schools. We have in multiple countries the platform where there's an effort to streamline health education within the school space, leveraging different programs. So it's not just health, it's already coordinated across health, education, nutrition programs, and so on, food security. So we have an opportunity there to bring together different actors and to address some of the key risk factors. Water, for instance, safe water, hand washing, hand hygiene, access to deworming, access to different interventions within that space. So I think that we should bring the education sector to the table, pointing out these opportunities, not just to protect our children within that setting, but also to use that opportunity to mainstream education among the students, within the school space, among the teaching staff, non-teaching staff, but also within the curriculum. That's a huge opportunity. And I see a comment from Teresa on the same, on ensuring that we do this in all schools, including special needs schools. Absolutely. So taking it to the level of the ministries of education and then using the different channels, parent-teacher conferences, community meetings, periodic meetings, and so on. So that, for me, is an largely untapped opportunity. Thank you.
Thank you so much, Ida. Chris, whether it be how to invest with in the education sector or reaching out for some funding on specific diseases, specific programs, what might be your thoughts on?
I think just to add to what Ida was saying on the education part, yes, I absolutely agree. And as she mentioned, the trachoma community does that quite regularly already. So other entities could utilize that same approach. I also think it's important to realize that not all kids are in schools, unfortunately. So we need to be able to find out those kids who are not in school and how do we have special programs for them. To answer the other question around promoting disease areas, I think involving the community that is most impacted, the ones who have agency, involving them in the promotion, I think is going to be really important on that. So whether it's people affected by LF or trachoma or whatever, because they can tell the story from the heart. And I think that's really impactful when we're talking to people like funders, particularly philanthropists who maybe aren't aware of the global health challenges as much as, say, institutional donors are. So involving the members of the community who are most impacted by a particular disease, I think is a really powerful way, and really taking that community-led approach to it.
That's a really good point, and hopefully having NOMA, the latest addition to the NTD list, is really going to shift how things are done, almost maybe create a new paradigm. NOMA survivors have almost immediately after the addition to the list organized into, as I'm sure you all know, the Elysium, the NOMA Survivors Association, and those survivors really being at the core of not just the advocacy, but the actual research, for example, informing and giving feedback on questionnaires and so forth. So I just wanted to make that little aside that I think there is certainly a very concrete shift, hopefully, in how things are done. And you're absolutely right, Chris. It's a very important point. Lots of comments and questions and feedback around the theme of education and integrating into the Education Center in the chat. If you're able to pop over and read those on the chat. Teresa Baird, very passionate about ensuring that special needs schools are also actively included, as well as religious school, trade schools, reaching those that aren't in formal education, as was highlighted. So thank you for all that. We're just going to move a little bit to a different theme. And please, if you do want to carry on with the conversation, it's happening right now in the chat. And we can follow that up after the call as well. We have here a question from David Rollinson from the GSA, oh, I'm so sorry, Irene, my mistake. The chat was distracting my attention and I completely forgot to hand over to you. I know you have a lot to add to this.
No,
my apologies.
It's okay. I was just going to add that, I mean, with the End Fund and the programs in our countries, we've been able to really engage like the education sector in NTD programs. I mean, there are the points where we, surveys are usually conducted, or even deworming exercises. I think it's a very important sector to ensure integration, because of course, the greatest impact falls in children, and it's all children, as Chris mentioned, the children who do not go to school. So it's important to really target all children wherever they are, including even informal schools that are really set up in humanitarian crisis situations. So there's a lot of opportunity working with that particular sector in terms of just even streamlining campaign efforts. So agreeing with everyone's sentiments on that. And then I think the question on FGS, I would say, maybe the first approach would be to really interact with the NTD unit within the respective country, so that you're able to understand what programs are available, and seeing who are the partners there, so as to see where to plug in, because I mean, we do not undertake implementation efforts, but I think there's an opportunity to, just understand what the context is within the person's respective setting, and then going from there in terms of funding opportunities.
Thank you so much, Irene, and all these points being really echoed by Dr. Nebe Obiageli from the Federal Ministry of Health in Nigeria, saying the education sector collaboration is key, because this sector is the custodian of school platforms, and that is what is used in school deworming and other NTDs interventions. The community and education sector are very important partners in this collaborative work. Indeed, thank you, Dr. Nebe. They do work hand in hand, and greetings from London to you. Another comment here we had about training public health professionals. Sorry, I've just lost it. Eugene Ruberanziza was saying, even most healthcare professionals, including doctors and nurses, only learn about NTDs after completing their studies. So again, education on so many different levels. I myself was just giving a talk to the public health registrars here in Barnet, Bedfordshire, and further afield, who had not heard of tropical diseases, but obviously we're in the UK, slightly forgivable. But let's move on to a different question, a different topic here, and thank you for your answers. So a question from David Rollison with the Global Schistosomiasis Alliance. Really interesting point. Greater integration can mean more work for the community health worker, often overworked and working in poorly equipped facilities. How can we improve training in diagnostics, treatment, data collection, etc.? So how can we facilitate the work of the community healthcare worker? I know this is a bottleneck that had been flagged in the policy paper. I don't know if someone would like to go first.
I'm happy to take that and then pass it on after. So Irene mentioned a couple of things. One was innovation. We're moving quite quickly in the innovation space. Now we have in many countries the community health information system. So there are efforts to train and to get community health workers to use digital reporting tools. We have opportunities to train them using those same digital tools. We have ongoing efforts at professionalization, and I cannot emphasize this enough. For as long as we focus on using community health workers as volunteers, then it's a bit disingenuous, isn't it? We're not helping them, and we're not helping them to strengthen this, and they're not helping us. You know, we have to go the full mile, help get them professionalized and remunerated properly, and then used properly. You know, engage them properly. So that has to be done. At the same time, yes, David, to your point, we do need to improve the capacity for training, to provide more regular training and mentorship and supervision. Unfortunately, there are no shortcuts there. We have to plan for those things. But it raises the point that Arielle brought at the beginning, which was, can we cost the package? Can we cost what is required to get them up to speed? To say that in country X, if we're going to support 10 community health workers in a particular village, what does that mean? We give them this training package, a tool, or they already have a tool, access to ABCDE. What does that mean? And how can we, raise the funding for that? But thank you. Over to you.
Thank you.
Marianne, I just would, add to what Ida was just saying, where I think innovation, yes, and tools and technology are fast-tracking things, artificial intelligence, that's all kind of going to make everybody's job a little bit easier, so that when you do have a community health worker who's a bit overstretched, using a tool or a diagnostic for diagnosis, I think is going to be really important. And I think as a funding community, we need to invest in those technologies and invest in incubator programs and accelerator programs that are really kind of charging forward with how to make public health delivery a little bit quicker and easier for everybody, especially at that community level.
Everything has been said, so I mean, I don't I don't want to repeat, but I think emphasis on comprehensive delivery of the services. So looking at the CHW, even as they go to the community, household to household, that they're providing the full package and they're planning their time using the relevant tools that are available to be able to help them plan better and be able to manage what we call the workload. So I think right now there are various opportunities and tools that are being tested to see how best you can maximize the efforts and improve efficiency and effectiveness, so that the community health worker is able to really provide a comprehensive range of services as they reach out to the community, which will help in terms of addressing the issues of workload.
Thank you so much. Chris, you wanted to add something?
Yeah, sorry, just on that point. I think it's a really important one. I think that in a lot of the communities where we work, there may or may not be an electronic health information system at the community level. So a lot of it is still paper-based. So how do we move beyond that and then have a direct link from the community to the national level, so that the national ministries of health and education and others and finance are making decisions based on data. So data-driven decisions, I think, are really important. I just wanted to make that point.
And on that point as well, maybe some of you were on our recent World Rabies Day webinar, but there is some amazing work being done by the GARC, the Global Alliance for Rabies Control. It is focused on rabies, but it's really about integrating all those data sources, so in real time, to see where a dog might be infected, where other dogs have been vaccinated, etc. It is amazing, and I hope it rolls out to lots of other NTDs. So I just wanted to point that as a possible solution. We've had an amazing discussion touching on the education sector. The FGS conversation is very close to many people's hearts on this call and is ongoing in the chat. We've also spoken about the funders and the funding, and I think it would be really great, having gone the full way from the community to the funding, to just finish off on the other really important part of this triangle, which is the policymaker. And there's a great question here by Anuka Guvras from the Global Schistosomiasis Alliance, thinking about politicians, policymakers, really the government side of things, and taking advocacy up to the highest levels. What role do you see for parliamentarians to increase country prioritization, investments, ownership, and how can they be engaged in countries where health is devolved? And all three of your organizations have worked very hard in this really fine juggling act between reaching out to policymakers in what can sometimes be perhaps uncomfortable conversations. What is your advice, and what do you think is needed? Perhaps Irene, you'd like to? Oh, yeah, go on, Chris. Sure.
I think a key element is having national plans, whether it's an NTD plan or a sustainability plan, whatever, and those need to be created lockstep with the policymakers, not by the NGO community or the funders. So once you have buy-in from the ministries or the government who's creating the plan, then I think it's a bit easier than to have conversations around policy changes once you have those kind of 5-year sustainability plans or NTD plans.
Thank you. That's very sound advice. Irene, would you like to add to this?
Yeah, I think also for countries, and it's important to have or develop an advocacy strategy, because that will really help in sort of breaking down who are the relevant targeted stakeholders, and designing appropriate messages to target them and push, for allocation of resources or commitment and support. So I think all the listed stakeholders that you mentioned are very critical. It's important to have that strategy in place so that you have something that you can monitor progress over time. You're able to see where that progress is going, and being very targeted and measuring that progress with that strategy. I think that would be the solution to do that. Including
Fantastic.
When you look at policy, I think, very beautiful policies are developed, and I think the gap that exists sometimes is just the operationalization. How are we disseminating these policies? How are we operationalizing them? And how are we measuring progress in all the levels, of continuum of care? Is it also important here?
Thank you so much. Ida, over to you.
Thank you. I know that many countries have parliamentarian health committees. I think that could be one way to, periodically convening them, and you could use the NTD master plan or sustainability plan and socialize this notion with them, right? There's a lot going on in countries. We don't expect that they will pay attention to everything all the time. So the breakfast meeting, the dinner, meeting with them and putting these on the table. I still think that in the NTD world, we don't have enough, and I believe Chris alluded to this. There's an issue of understanding how serious the impact of NTDs is. People know a range of NTDs, but they're not, most people who live in cities don't understand how serious NTDs are. And so breaking it down for parliamentarians whose communities, some of them are quite rural and quite poor as well. That would be an opportunity to open their eyes to some of these issues. And if possible, bringing them and linking them with communities that are affected by NTDs, you know, will allow them to see firsthand what it means and create champions out of them, I guess. And then you can use them to have a conversation about funding, about advocating for more funding. I like Gilbert's point about increasing the stature of the NTD unit, you know, making them a department. In many countries, they are subsumed within other departments, and so they have no agency. They cannot request for money beyond a certain point. They do not have a voice. So that would be an interesting opportunity to use them. Thank you.
Thank you so much. I think we've gone through most of the questions and the points on the chat, and thank you so much to our audience that has been so engaged. It's been really interesting and informative to see and hear your perspectives and your questions as well. I think also what we've heard a lot throughout this 90 or 80-minute conversation is the need to integrate, unify messages, but also then become quite granular, and even Arielle used the word that, you know, shall not be spoken, vertical. Use that approach at the right time. So Ida, you came to us with already a very ambitious agenda and presentation, gave us lots of food for thought, and then our amazing speakers added even more to that. So I think we've had a very fruitful and rich discussion. This is going to be further refined, organized, and put into a policy paper. For all those that have been on the call, please, this should only really be the beginning of a conversation. Feel free to keep in touch and to also feed into this. And just to kind of bring all our discussions and thoughts together, Ida, perhaps since you launched us in such a great discussion, I'll hand over to you for some of your concluding thoughts and, all importantly, next steps. What do we need to do? What can be done?
Thank you. So I will just reflect on what has been discussed quite at length. So I would throw it into, let's say, 4 broad buckets. One is the work around leadership and governance, and the role of high-level commitment, the parliamentarians, the minister, the prime minister, you know, bringing on board politicians, but also people outside the Ministry of Health, other ministries, to the table, to advocate not just for prioritization, but for funding, which is already within these spheres. Better partner coordination, better use of funds and reporting and tracking, right? These have been mentioned several times. The other is more multi-sectoral action, more deliberate multi-sectoral action with education, with WASH, with nutrition. There are already huge opportunities. How can we make them more sustainable? How can we make them more deliberate? Then the work around community, more patient-centered care, better community engagement, more meaningful two-way communication with communities. Then the work around more system strengthening, supply chain, health information systems, training, which we also discussed quite at length. So it's a broad list of things which we already know, but which we can do more deliberately and better with what funding we have now. I hope I did you justice.
Mm-hmm. Absolutely. Honestly, a huge, huge thank you. Arielle's gone, but I hope that she will get wind of this in the recording, but a huge thank you. A huge thank you to you, Irene, and the N Fund, and you do so much for this sector, and at some level we've all collaborated with you at some point, so a really big thank you. Chris as well, the Fred Hollows Foundation, really setting the benchmark, setting the scenes on how to make all those amazing successes with trachoma elimination possible. So a huge thank you for your insights. And Ida and everyone at UNICEF, a really big thank you for galvanizing this conversation. Thank you to you, Ida, but also may I take a moment to give a big shout out to Ezra Jerome, who's Deputy Director at the Foundation Partnerships at UNICEF USA, and also Claudia Marino Garcia from UNICEF USA, who were working tirelessly behind the scene to bring this all together. Big thank you. I can't name everyone, but we heard from Solange Kakou from Côte d'Ivoire. Thank you for being here. Jaime Ocampo Lucena, Paras Pokrael from the Leprosy Mission Nepal, Malek Gebrehewat, everyone who tuned in today. You've made this conversation really, really interesting. Oh, a few more questions have popped up on the chat, so we are coming up to the end of our allocated time, but I'll leave the chat open if people want to carry on, and I'm sure that our speakers will be more than happy to keep in touch and remain in touch, and of course we will as well, just to make sure that this conversation keeps going, and the policy paper will be circulated as well. And hopefully, moving on to other topics, you'll also be able to join us here at ISNTD in November. We have another very varied and exciting range of talks coming up for you, from antimicrobial resistance in malaria, where we promise a few plot twists. We'll also be talking about conflict and leishmaniasis. And of course, it being the month of COP29, we can't miss talking about climate and NTDs, as we do every year at this time of the year. So please join us for that. And of course, anytime you want to be involved, do get in touch. It's always a pleasure to learn and share from each other and from everyone. On that note, again, a final huge big thank you to our panelists, and let's definitely keep in touch. You're getting lots and lots of amazing feedback on the chat. That was excellent. Thank you, everyone. It's inspiring. Excellent meeting. Many thanks. And so all that's left for me to do is to wish everyone well, and hopefully let's definitely keep in touch until next time. Thank you so much.
Thank you.
Marianne.
And bye.
Thank you. All the best.
Bye.
Thank you.